All right, wonderful.
Okay, good morning. It is great to be with many commissioners here in person and many others over WebEx, Zoom. We are, of course, this commission has taken on many challenging things. Today's new challenge is hold a meeting in a hybrid fashion and getting really excellent feedback from everyone. So I'm looking forward to today. Before we dig into the final report and listening to all of the commissioner and public's comments on the report and reflecting our now 2-year journey, I'm going to turn it over as we have to Karen to walk us through the meeting and take roll call.
Thank you, Secretary Galley. Good morning and welcome to commissioners and members of the public. Just to go over the meeting protocols and ensure that the slide is up for that. Thank you. This meeting is being recorded. We do have commissioners who are participating remotely. Welcome. And for you, as always, you have the ability to mute and unmute and the option to be on video. Please do mute yourselves when you are not speaking. And for commissioners who are here in the room, if you could please turn on your mics when you're speaking, you'll see a red light come on. And when you're finished speaking, please turn those off as well. For those who are virtual commissioners, if you would like to speak, you'll still find the raised hand feature. In WebEx, you click on the participant panel and find the raise hand icon at the bottom. And we'll be keeping track of those who would like to speak virtually as well as those in the room. All commissioners who are here in the room, please do have your devices muted as well. For members of the public, good morning and welcome. If you're participating remotely, you can access the meeting through WebEx or through the toll-free conference line. Both options are listed in the posted agenda on the Healthy California for All webpage. The toll-free conference line is listen only. So if later on in the meeting you wish to speak or provide written comment through chat, you will need to use the WebEx platform. So please prepare yourselves to do that if you would like to provide public comment later. Anyone can provide comment via email at healthycaforall@chhs.ca.gov. All public comment that's provided in regard to this meeting will be part of the public record. All right, that completes the protocols. I'll move now to the roll call. I'll start with commissioners in the room and then turn to those who are virtual, and we just appreciate a hello from you. So have your buttons ready. All right, Mark Galley.
Present, good morning.
Jenny Chin Hansen.
Present, good morning.
Sandra Hernandez.
Good morning, present.
Bob Ross.
Good morning, President.
Richard Scheffler.
Good morning, present.
Sarah Fox.
Morning, present.
Anthony Wright.
Good morning.
Jessica Altman.
Good morning, present.
Good morning and welcome to the commission. Don Molds.
Good morning.
Morning. Michelle Boss.
Good morning.
All right, and now turning to our commissioners who are joining us through WebEx. Please be ready to unmute yourself and say hello. Andy Schneider.
Afternoon from the East Coast, present.
Kara Desert.
Good morning.
Good morning. Bill Shao.
Good morning, present.
Antonia Hernandez. Okay, not yet. Carmen Comsty.
Good morning, present.
Good morning. Richard Pan.
Present.
Do we have Rupa Maria? Okay, and Jim Wood? Okay, we'll keep an eye out for them. That completes roll call. Secretary Galley, I turn it back to you.
Great, thank you, Karen. And let me just say a couple things. We are not sure, heard this morning that Rupa will unlikely be able to join, and that Dr. Wood will be joining a little bit later in the meeting due to other obligations. Obviously, very active week for the legislature, so appreciate his service there. And then I also want to take a moment to extend a really warm welcome, Jessica, to you for joining the commission. No small, yeah. For both Sandra and I, really excited to have you in this seat as members of the Covered California Board. And I know a number of people in this room have already had a chance to start getting to know you and your commitment to not just what this commission has been about, but really advancing what Covered California has been doing for a decade, and what really looking forward to your leadership moving forward, and appreciate you rolling up your sleeves and learning what we've been doing. I know we had a chance to talk about it early, even before you came, and your general excitement about where this work can take California collectively. So appreciate your involvement here. In a few minutes, I'm waiting to see when I can plug in Ana Montesantos, who is going to be joining us. We thought it appropriate. I think many of you remember 2 years ago, we started in this exact room with our only other in-person meeting. I remember it was a day with great anticipation. Ann O'Leary, then the Chief of Staff for the Governor, came and opened up these meetings and reminded us and set us out on our journey to do something that mattered to the governor, mattered to the legislature, mattered to all of us, but mattered deeply to Californians, that we come together to reimagine what healthcare can look like through a lens of unified financing, considering single payer and its principles, and the amazing work that this commission has been on, parallel to the journey the state has been on through COVID. And in Ann's opening remarks, she reminded us of that importance, but also challenged us to come together in a way that often this issue doesn't always bring people together. And I am really pleased, as I reflect at the 2 years, how this commission grew, changed, challenged ourselves, had tough conversations, sometimes not always pleasant, but really a tremendous amount of progress. So Ana will be with us soon to share some reflections and to remind us where we've been. As we, yeah. Oh, yes.
You get too close, it gets a little scratchy, so keep it.
Okay, is that a little better? Yes. All right. Thank you. So when she joins us, we'll jump in with her comments. So today's objective is really to look over the final report. And we've done, as we have throughout this process, really, I appreciate our team of consultants, Vishal from Cal HHS, and the tremendous work that together we have done engaging commissioners and engaging feedback on these reports. You remember that back in January, we gave ourselves a little bit more time to get the report done, and boy, am I glad we did that. It was at a really difficult time from a COVID perspective. It was at a challenging time to get everyone's attention on this work, and so we decided, instead of just having a single draft go out, then have a meeting and hopefully all come to some agreement on what to do with that report, that we did it in a couple of different steps. We put together a draft, shared it with the commission, received excellent feedback. I'll review how that feedback impacted the report in a moment, and then also gave a chance for some comment from the public, and then put together a second report that was sent out just a week ago. And I think we've had tremendous and positive feedback around that report. It doesn't do everything that everybody wanted it to. But I think as I look back at our process that started one way and ends now this way, I'm really proud of how we were nimble and how we really leaned on the commissioner's expertise. Nearly everyone on the commission had a chance to be the expert on the commission, to share a perspective, to share their experience, and to really fill us in, as the governor likes to call it, in a California way around how this matters. And what your perspective is on each of those issues, rather than looking and turning to outside consultants for every bit of our commission content. We looked internally, and it made me super proud of the rich experience, knowledge, expertise that we as a commission have in so many different important areas that have impacted the report. And as I look at those in the room, the commissioners in the room today, I just have a deep debt of gratitude as I kind of scan the room on the meetings you all contributed to, that you made them better, you made them more thoughtful, you made them more relevant, and not just in the discussions, but those presentations were very, very important as well. And to those not in the room, the same. We set up meetings in important and somewhat unusual ways, sometimes hitting different viewpoints that we knew would be different, so that we could hear and sort of struggle with some of those important aspects. And I think it made the content of the report that much better. We also need to acknowledge that we didn't do this commission in a vacuum. We did this commission at a historic time in our state and our nation and our world, during what is arguably not just the most important public health emergency that we faced, but frankly social emergency that we have faced in our nation. It raised a set of concerns that so many of you have dedicated to your life to working towards and against. The inequities that we have seen unmasked, the opportunities for change accelerated. And this commission had so many important conversations during tumultuous times when not only were we all busy and distracted doing other things, but I think those other things were exactly what brought this commission together. And I wonder sometimes, not only if we didn't have COVID, what this commission would have put out, certainly something much sooner than we are advancing today, but I don't think a product that really was going to be anchored in some of the guiding principles that really seem true in this report. And although we come at this looking at financing as a key lever, I think this commission raised up more than anything the importance of equity, the importance of community, the importance of integration, the importance of so many things we know drive to the different power structures that in healthcare we would like to see changed in California. I will also say, before I sort of go to the more formal comments and walk you through some other slides, that the work of this commission, because it has kind of worked over the last 2 years, I see it reflected in the proposals of the administration as we sit and look at the last 2 budgets. At the other end of this room, we have Michelle Boss, the director of DHCS, and she put out a RFP for Medi-Cal managed care plans that I think, because of the work and the conversations of the commission, it reflects some of the values that come in that proposal. If you look at some of the work we're doing on health information exchange, if you look at some of the work on coverage, if you look at other parts of the administration's priorities, I think you see in them the fingerprints of the commission and the thoughts and thinking here. So the idea that all we did was work towards this final report, I think is inaccurate. I think the work and testimony, the compassion and the passion of this commission has really lifted the bar in immediate ways in our state, and I'm proud to have had a hand in helping make sure that that is reflected in what we do. So with that said, let me just walk through what our goal is today. Even more? Okay.
We'll let you know the minute our speaker's here.
Okay. And then how do we get the slides up?
Sure.
Who knew the hardest part was getting the mic right? So today, as I'm giving my opening comments, we're going to soon turn to each commissioner and have each commissioner reflect on both the process, but mainly the report. And the goal is to hear one another's certainly deep considerations in the hope that at the end of the meeting, after public comment, we'll be able to do what the commission should do, is take an advisory vote as to whether we advance this report to, and all of the comments that would go with it, and we'll talk about that in a minute, to both the governor and the legislature. And that's a very important, not final decision, because I think what you'll hear today is this report has concrete next action, concrete resources to go with those next actions that would keep the work going. But that this report does reflect the culmination of our work together. Next slide. Okay. Yep, please. Next slide, please. Okay, I've been doing those. All right, so again, commissioners received, just to review the process, draft on March 17th. Comments were solicited through our survey process that the commissioners have gotten to know pretty well. We used a survey process throughout the last 8 months of the commission to make sure that in between meetings, we were able in a very transparent public way to get the feedback of commissioners on important decisions, important ideas that are reflected in the report, but really helped shape the content of meetings and the discussions that we had. That input was assembled and posted. It was taken, so much of it, and we'll go over some of that feedback and how it impacted the final revised version that was shared with commissioners the evening of April 18th, so just a week ago, then shared with the public on the 19th, and that is the basis of what we'll be discussing today and taking an advisory vote on. Next slide. So here are sort of the list of concrete ways that between the March 17th report, the feedback we received, and then the April 18th final report, how it was changed. First, the great feedback to add an executive summary. So a 4-page summary is added at the front of the report. There is an expanded description of some of the problems with our status quo current system of financing. There was a clear articulation of 2 important scenarios, the direct payment scenario that we talked a lot about, but also the idea of payments directly to health plans or intermediaries, and why they were analyzed as part of this report. That offered additional data points from the community engagement findings, this important piece of work that we did, that happened before it was presented last summer, but really, I think, a very impactful part of the Commission's work. Grateful to those who helped make that happen as part of this Commission's undertaking. Elaborated on concrete steps to address the problems under the status quo system, and imagine those as really the groundwork or the foundation to moving forward with a unified financing approach in California. And then what was very important to, I think, many of us, myself, many commissioners, our consultant team, was that we clarified as much as we could priority actions and next steps. I think whenever you go into a commission like this, your dream and hope is that you create something that has staying power, that has concrete actions, and doesn't sit on a shelf. And we believe that this section helps us get there. Next slide. So in addition to the written commissioner comments, I want to remind the commissioners that they may submit comment letters that can be included as part of an appendix that will be forever moving forward connected to the report. Those will be due before May 6th, and we hope they can be 2 pages or less. I imagine some of you will take the option to write those letters. They don't have to be 2 pages, but I think just as we opened up these commission meetings, you'll remember that prior reports, prior findings from other reports were really germane to how we began. And as much as this report will help build towards other efforts as well, I think it's important that we have the full complement of input from commissioners as we move forward. Next slide. So before we get into commissioner discussion, I don't know if Anna has snuck in on the Zoom. Is there any way to tell? She's coming in person, okay. Okay, so I think she'll join us towards the end of our meeting. So what I want to do now, we have just roughly 65 minutes to engage the commission on their thoughts. And just as we have before, I know we all have so much to say and so much to add on this report, on this effort. And I wish we could give everybody a full 20 minutes, but we unfortunately are down to working with about 3 minutes each commissioner. So please keep your thoughts concise. I'm already getting lobbied for 5 minutes each. We'll see how that goes. It was a lot harder to lobby over Zoom, so we'll see how it goes. I wanted to maybe start in the room. So while those on Zoom, you're spared. You get to go second as a group. But those in the room, I think the first person I'd love, Sarah, would you mind going first? And yep, Sarah Flock. I know. She's at the end of a table across from me. Easy to see. But if you wouldn't mind just starting us off.
No, he's going to give me his 3 minutes.
Oh, he's giving you his. Yeah, no selling minutes, commissioners. Doesn't work that way. But Sarah, it'd be great to hear from you. You were formative at the very early stages on a lot of the actions that are happening this year, whether it's the work of this commission or some of the other work that the administration and the legislature is advancing. So I'd love to start with you. Then maybe we can go down your table, and then we can come here. And Richard, I'll bring you up after we hear from Michelle.
And again, commissioners, probably pulling the mic a bit up, so not towards you, but up, so there's some distance is best for clarity. Thank you.
Does that work?
Yes.
All right.
Thank you very much.
Thank you, Dr. Secretary, and thank you to all the commissioners. I do plan to submit written comments, so I'll keep these short, although they will be in 8-point font, single-spaced. So first of all, on the process, I think this is an incredible group. So just thank you to the administration for assembling such a wonderful, brilliant group. And I hope maybe there'll be a role for this group continuing, because our discussions are definitely not done at all. And I will say that in terms of process, I thought the surveys were incredibly helpful. I really enjoyed in between meetings being able to read the comments of my fellow commissioners, and they actually changed a lot of my thoughts on many things. So I thought it was a very productive process. On the report, I appreciate the second draft. It did incorporate some of the recommended changes. It's hard to focus on what exactly to say. I will say, I think originally, and I know this was changed, part of what we are doing is so incredibly groundbreaking and historic, and it is in response to a truly broken system that the pandemic just exposed all the problems with. And I think we heard so much passion from the commissioners about this subject and from all of the public comment. This is a very deeply felt emotional issue. And something that we are going to have to move the public on. And so I think capturing some of that in the description of the problem, how fundamentally broken the system is, I think would be important to highlight that. And then to contrast that more clearly with how unified financing addresses those issues. I do appreciate that we are moving forward on unified financing. And so to really see, like, this is on every aspect of the problems of our healthcare system, including saving billions and billions and billions of dollars, that this is what this system will do, and just be very clear about that up front. And then second, I do think the bulk of the report should be on what are the concrete next steps? What is our plan? And I do like that this second version has that more clearly. I think there is a lot more that could be included. I appreciated that this report included some of Professor Xiao's comments. I know he had 7 steps that I wrote down verbatim when he said them in the meeting. I think that should be just part of the foundation that we are doing, because it was so important. Most of it was on cost containment, and I think politically and just fundamentally, we are going to have to get our arms around cost containment and every aspect of that before we move forward. And then I do think there is much deeper discussion that we need to do on payment, on the delivery system, and care coordination, and really figuring out that piece of it, and getting corporate profits out of healthcare. It is not the business of healthcare. It should be that we are doing a healthcare system that cares for people. I have so much more to say, but I am going to stop there. And just thank you, and thank you to my fellow commissioners. This was a wonderful experience, and I hope we can continue our work in the future.
Thank you, Sarah. Thanks for being a champion going first. Appreciate it. Anthony.
So again, Anthony Wright, Executive Director of Health Access California, and I again want to thank the administration and my fellow commissioners. It has been a rich conversation, one where I've learned a lot, where I think this is a conversation that's been going on for many, many years, and the fact that we're still diving into these issues is reflective of how rich this conversation can be. I would acknowledge, just as we acknowledge our ancestors, I would also acknowledge the many people who have worked on this issue over decades, including some that have passed in the time that we met in this room before. An activist, single-payer activist in the room 2 years ago, Don Beckler, legislators like Pete Stark, public servants like Beth Abbott, academics like Phil Lee, and it suggests the heritage that this effort has required to try to continue to make sure that we have a system of not just health access but health justice. We also know that this wasn't in a vacuum, and there were other conversations in other venues, including the legislature. And I think that the process that we undertook here and the report that has been produced, shows clearly that the conversation about getting the universal health care with a unified finance system, to getting the single payer, that conversation is very much alive, regardless of the conversations that also are going on in the legislature or other places. This report, I think, provides a really important service by clearly endorsing the benefits of moving to a universal system with unified financing, and that really talking about the benefits and detailing them, and I think in as compelling a way as possible about the ways that it would save money and lives. I think it's a remarkable finding that could be its own headline, that without action, our healthcare system will cost $158 billion more in less than a decade, and that is. That is on the par with the General Fund of California. That is a massive amount of money that our system is unsustainable, and it will become increasingly so for individuals for if we do not take action. And so I think that there is a clear urgency that one can use the report findings to spur the action that is needed. I think we also want to be clear that this is not just getting to universal coverage, as important as that is to make sure that people have primary and preventive care and deal with many of the issues that we were dealing with regard to the pandemic, but that this is about ensuring the sustainability of a system in the future for one that is simpler and more affordable and more equitable and more responsive and respectful for all of us. And so so I think, so I'm pleased that for what's in the report with regard to those endorsements, those clarity, and I think I hope that this then informs the work of sister commissions in Washington and Oregon and other states. I also think that while it expresses that those benefits, those urgencies, I think it also is clear-eyed about the challenges. And many of us are aware of the political barriers, including the insurance and industry opposition or ideological opposition, but the very real work that needs to be done with regard to policy and with regard to process to move this forward. And I see that as a step forward, because getting to that level of detail means that we're actually talking in reality about what's the work next that needs to be done, that we're not talking about conceptual level if we actually want to move forward to be really clear. So for example, I thought it was a service, just those 2 pages detailing the changes in the state constitution that need to be done. That was a real service to this conversation and, okay, what needs to be done to move forward. But I think ultimately the test of whether this is a successful report is what do we do with it now, and what are how do we use it as in terms of going forward. And so I appreciated the fact that there is a detailing of some of the steps that the administration has already taken that get us closer, that are strategic steps toward the goal. I think, and I've been proud to be part of many of those conversations. And I think proud that the legislature has over a dozen bills that also would take similar steps. I do wish that the report did more in this regard, that we talked about it more, about what those concrete steps are to get closer. And I appreciate that the report details a threshold issue of the need of federal approval. I don't think it's the only threshold issue, but it's certainly a big one. But I think there's a lot that we can do, even as we have the conversation with the federal government. There's stuff that we can do right now, and there's actions that this administration and this state is already taking, and that we should be proud of Californians that we are taking. I think there's other things that are in the works, and I would hope that maybe as a result of this report, we can put some timetables to that, some goals, some timetables, so that this is not open-ended, but this is a goal of getting to, whether it's the patient identifier, the standardizing payments, some of the other work, so that there's a clear trajectory of where we're trying to get to. And I think that there's more that we can flesh out. But I will also acknowledge that, we could spend another couple of years and another couple of hundred pages, and there would still be more questions, because that is the nature of what we're doing here. So I appreciate that this is the report for the moment, but then we absolutely have to figure out and commit, and I will, on behalf of myself and my organization, commit to taking those next steps of what do we need to do to move forward to get to the goal, to do the organizing and the education in the public, but also to figure out these policy issues, to move through the processes that we need to do at the state and federal level to move forward. So I've been humbled to be part of this conversation. We know, and I just want to say that this, just to conclude on the urgency, which is there's people who, yes, there's people who are uninsured who desperately need the health care now. There's also people who are struggling with costs, who find our system complex and confusing and Kafkaesque, and who need a simpler, more equitable system, and we should take every opportunity to take the steps, the big, bold steps as soon as possible in the various ways concurrently to get it done. Thank you.
Thanks, Anthony. Jessica.
Thank you. First, let me thank the whole commission, and in particular Dr. Galley, for the very warm welcome. It's wonderful to be here. I will keep my remarks very brief, given that I am the newest member here and didn't have the opportunity to be a part of what were clearly such important and robust conversations leading up to this report. But I do just want to say, first of all, what a privilege it is to be in this seat, and both in this seat as a member of this commission, to sit along this esteemed and thoughtful group, but also to be here representing Cover California, an organization that its history and mission are so clearly aligned on these goals of improving healthcare, making healthcare more accessible, more affordable, more equitable for Californians, and that this is such an important effort in that regard. Mostly, I just want to commend this group for those conversations that were clearly thoughtful, had breadth and depth, really brought the perspectives from across the table of people in the healthcare system, and that is represented in this report. And I really do look forward to getting to know all of you better and learn more about this process and these efforts as I hit the ground running here in California. So I'll just close with saying I look forward to lots more to come, and thank you all.
And to Anthony's point about what do we do now, it's really important that Jessica is part of this conversation because the organization she leads has a lot to do on that. So grateful. Thank you for being with us. Don.
Great. Thanks. I also wanted to start by thanking fellow commissioners. This was what I thought was a really great, sustained conversation. It was respectful, but most importantly, we all come at this from a different perspective, and it would have been really easy to dig in early and go right to the place where you start trying to figure out what all this means for the small, medium, or large constituency group that you work with on a daily basis. And we didn't do that. We stayed above that fray for the entirety of the conversation and managed to engage in a way that I thought was really important. I also wanted to thank the team of consultants who contributed what I thought was a really fine body of analytic work to this, at times at their own peril. Nobody likes everything, especially when they're identifying challenges. And this was a group that was trying to move forward with a big idea, and big ideas always have challenges, or they would have happened already. And they did a really fine job both of identifying those, talking through ways of working through them, and I thought throughout were very even-handed and enormously helpful. And also wanted to thank you, Secretary Ghali, and your team, Vishal, and others. I remember, when after our first meeting, sometime, I can't remember when it became clear that you had a second full-time job, which was fighting this once-in-a-generation pandemic, and figured that it wasn't going to be possible to pull this back together and keep this work moving. And you managed to do that, and that's really remarkable. I remember now vividly the daily briefings that the governor and you were doing on COVID. And at the same time, having this work picked back up again and keep moving forward. So just want to recognize what an incredible amount of work that was, and how remarkably well you pulled it off. So the thing that that I've focused on for a while now, as I've thought about the work that we've done, is really sort of what we can. So we're all aware that there are some really profound challenges that face the agenda that we've all identified. Many to most coming out of the federal government and needing that partnership. But we all, I should say, identified a bunch of really important steps that I think we can take on along the way. And those are the things that I think we should be focusing on in the immediate. I don't think we should be giving up trying to make the entirety of the healthcare system here in California and ultimately in the nation much better by taking some of the steps that we've identified, but a lot of really practical steps. So cost containment, which was mentioned already, delivery system reform, which was mentioned already, moving forward to push the centrality of primary care in our health system, really critical, something we can be doing now. And then the other one, which I don't know has been mentioned yet, but really came out as part of these discussions, which is making our system more equitable, which is something that we can do now. And I think those are things that we really need to be focusing on as we think about more transformative steps for the entirety of the system. Those are really hard tasks. It's really heartened to see the governor put money in the budget in his budget this year for cost control, the steps that have been taken since this commission started to make equity front and center, and a lot of other steps that I think are really important that we should continue pushing for as we, again, as we push for the larger transformation. And I'll stop there. But again, really grateful to be part of this process, and thank you for including me and CalPERS.
Thank you, Don. Michelle.
And commissioners, just very quickly, if I may just ask one more time if you could point your mics upward and actually refrain from leaning in. I know it's counterintuitive. Thank you so much.
All right. Thank you for the opportunity. Relatively new to the commission, joined in the fall, but really have appreciated the robust discussion. And as Secretary Galley alluded to, many of the discussions, my first meeting was about consumer advocate or the consumer perspective, and really those discussions have influenced how we think about things at DHCS, and really appreciate being part of the conversation here because it really is making some lasting impact in the Medi-Cal program, I think, going forward. Also, just want to frame, I think, we are all united in our goal for healthcare for all, quality, accessibility, access, and really appreciate the commission coming together and really fostering the conversations on those topics as we think through what can we do in the short term, what can we do in the medium term, and what's the long-term vision for achieving those common goals. And with that, I just want to say thank you again. It's been a wonderful opportunity to be part of this conversation, and thank you.
Thanks, Michelle. And to say that you were relatively new to the commission ignores the essential work you did as undersecretary at the agency to keep this work going. And so I'm just really grateful to you for your leadership, not just over the last many months at DHCS, but throughout the pandemic. Your work at agency was second to none, and grateful to you and Marco and others who helped us manage hard streams of work successfully, hopefully gracefully, to keep leading California. So thanks to you. Richard Scheffler.
Thanks, Mark. Before I make my comments I have a question for Mark. Is there a reason why all the senior people are at this table and all the junior people are at that table?
Wait a minute. Let me move over here.
Wow. Yeah.
Sit down. You're with the elderly statesman here. So the answer is?
The answer is no answer.
Okay.
Yes, there we go.
Randomized cohort.
Well, as I've told my students at Berkeley for over 40 years, do not let the perfect be the enemy of the good. Well, that's a quote that comes from Voltaire. The report is good, and in many places, very good, but it is not perfect. And we can do better, and in the future, I suspect the follow-up will improve it in many, many ways. The size and complexity of California makes any attempt to reform, revise, change this healthcare system extremely challenging. To give you a sense of some magnitudes of the size of our healthcare system, healthcare spending in California, just the spending in healthcare in California represents over 2% of the gross national product for the entire United States. 2 out of every $100 in the economy is spent on healthcare in California. It is the size of the entire budget of Ireland. It is big, and it is hard to change. Major changings of payment policies are not easy, as we found in our deliberations, because for every change, there are winners and there are losers. I personally believe that capitation payments are the best payment method, but is not perfect either. Capitation is used to pay for over 70% of the lives in California, and this is the highest rate in the entire country. We have learned over 40 years of research and experience that fee-for-service encourages overuse, waste, duplication, and makes care coordination extremely difficult, if not impossible. The pandemic has shined, as others have already commented, a bright light on the disparities of our healthcare system and what needs to be addressed, and I would say without any further delay. I learned a lot from the community input, and it should not be ignored. It is foundational to our healthcare system. Of course, being an economist, I would say costs need to be controlled and waste eliminated for us to have an affordable, equitable, accessible, and high-quality healthcare for all. The proposals for the Office of Healthcare Affordability, I think, are crucial to this effort. And I would encourage the legislature and the administration to establish this office and to give California a chance to get its healthcare costs under control so we can move on the rest of our agenda. There is also a role for the Attorney General in healthcare, which I thought was missing from the report. The Attorney General has a lot to do with transactions in healthcare, charity care, mergers, acquisitions, and also policing the healthcare system. And I think we could have given it more attention, and perhaps in follow-up, we will. I am proud to have served with my fellow commissioners under the leadership of Secretary Ghali. We moved the ball forward, but there is so much more to do. I tell my students, if it was easy, someone would have done it already. It's not easy. California has the resources, and now we need to double down on our effort to implement what we have discussed and to move on so we can have health care for all in California. Thank you.
Richard, thanks. And thank you for lifting up the community engagement piece. And before, Bob, you go, I just want to take another moment to acknowledge you, Sandra, and Tonya for really coming together. When we weren't sure, given the impact of the pandemic, how our own timeline was going, how we would make sure that we brought the community engagement piece that was so important to so many of us on the commission, our consulting team, the administration, the legislature, and you all stepped up to not only fund it, but really guide it. And I remember when we had the presentation, how clear all three of you were on the importance of that work to not just you three, but your teams who really dug in, rolled up their sleeves, and felt like that was going to be an important contribution. As I reflect on the report in that section, I see how it seeps into other parts of the report, both before it and after it. And I'm just really grateful to your leadership, not just for this piece, but on those issues over the course of your career. So with that, Bob, please.
Thank you, Secretary Galley. So I'm reminded of, there's a football halftime show called The Fastest 3 Minutes, where in 3 minutes, they summarize what happened in 16 games across the NFL, and they actually managed to pull it off. I don't know if I can pull that off in 3 minutes. I'm going to try and stay as close to it as I can, Mark. So yeah, just kudos again to you, Mark, extraordinary leadership and stewardship, your staff and team, and the consultants who did a fabulous job of contributing to this report. Like Commissioner Scheffler, not a perfect report. I think it's very good. I would rather come out of here with an approval vote for a very good report with excellent follow-up and implementation, Anthony and Sarah and Richard, than the other way around. So let's commit to the business of implementation and follow up. If I have an over, and I mentioned some of this in my initial comments, Secretary, to in the report, we managed to get this work done during Trump White House, George Floyd, Breonna Taylor, January 6th insurrection, anti-Asian hate, a sweeping of states embarking on voter suppression in communities of color, flagrant attacks on LGBTQ and trans communities, including the criminalization of health providers who are providing services to trans kids and families. All of that is happening as we hand this report to the governor. And so my initial reaction was a little more poetry to go with the prose about the moment. It got better in this last version, but this is a very important. The governor campaigned and was inaugurated under a framework of a California for all. California is our nation's first state of belonging, and this report shows up to him in the context of that. And so anything we can do to sort of to strengthen the poetry part of that part of the report, I would be in support of. Quickly, I just affirming so many of the comments of my colleagues. I'm not sure what how the follow-up is going to be structured. It feels like we're going to have something that resembles working groups or task forces, or I'm not sure what that is. Certainly, unified financing is the biggie. And I think costs should be attached and affixed to unified financing. I will say to you, Secretary, and to the governor, because, and the report does a great job of pointing out the criticality of the unified financing piece, we need the baddest ass team in America working on that. Like, leave no stone unturned. If that's going to take a Tiger team of, I don't know what the number is, 5 people, 30 people, 50, I don't know what that is, it looks like. Whatever you need to get the equivalent of LeBron James and Steph Curry and Kareem Abdul-Jabbar on that team from a health policy standpoint, you got to get that kind of talent, okay? Because we just can't leave that to kind of business as usual. So get the best talent possible on unified financing. And I'm putting my day job hat on if you need philanthropic resources to help for that, we're here. The other ones I'll just quickly sum up: workforce. We've got to do something. The governor, great proposal on workforce, strengthen a workforce pipeline in the budget. Maybe the legislature will add to that. Maybe they won't. I'm not sure. Let's move on that. As my colleagues have mentioned, something committed to the intersection of health equity, racial equity, and community and prevention and public health. I don't know whether that's one working group. I'm more of a lumper than a splitter, but it feels like that needs some dedicated attention and heft. And then data and information exchange as well as has come up. A lot of wood to chop, and the implementation is going to be critical. The last thing is that those last three people at that table, Commissioners Altman, Moulds, and Bass. And by the way, Michelle, your name is missing in the report on pages 13 and 14. For some reason, you're not on there. So I offer to, and this is not as a commissioner gift, this is after the commission is over, so I don't run afoul of any Bagley Keene with this offer. I want to treat the three of you to dinner with Mark, and you guys can come out with a story about how we're going to blend the purchasing power of Medi-Cal, CalPERS, and Covered California, and funnel that into our unified financing proposal as a good way to start. So, if you get that done, I'll pick up the tab for the dinner. If you don't get that done, then Mark pays. Okay? And then lastly, I was sad to see AB 1400 fail. And I couldn't be vocal about it because of my position and my day job, and as a commissioner, we just can't be vocal about active legislation. We will be committed to, and I'm sure we'll have follow-up conversations. I'm speaking to my philanthropic colleague, Senator Hernandez here. It's going to come back again. Some version of single payer is going to come back again. And I don't know how many election cycles we are away from that, but you have my commitment and our commitment, Secretary, that we'll commit now to getting better ready for that when it comes. And Commissioner Wright is someone who I know is going to be giving a lot of thought of this as well. But in terms of narrative and messaging and organizing and mobilizing and advocacy, we've got to be in a better position the next time it comes up than we were this time. Thank you.
Thanks, Bob. Sandra.
So I wanted to build on this notion that it's been decades of work in California to bring us to this report and these recommendations and all the many things that the agency is undertaking currently to put so many of the critical pieces together to get to an equitable, dignified, simplified delivery system for all Californians. We definitely sit on the shoulders of many, and I am particularly honored and to have been able to sit amongst commissioners and continue to learn about what's possible while we all have a common vision of what it should be and can be. I also have had the opportunity over my career to put together many commissions, and I understand the immense process challenges, analytic challenges that go into this effort, and I just want to give a nod to the team for just doing an exemplary job on process, on analytics, all of that, of course, under your leadership, Secretary. I was struck by something that you wrote in your letter transmitting this report, which is that changing our financing system into a unified system is necessary but not sufficient to get to a reform delivery system that treats all Californians with dignity. It is a critical one, and we should pursue it vigorously, but it is not an end unto itself. And so I also appreciated that in this report, there's reference to the many efforts that are underway in California that are prerequisites to a sustainable, accountable, and equitable system. Workforce. It's been said numerous times, there's a roadmap. The governor and the legislature have done great efforts in that regard. It's not just that we need the people, it's that we need the people who can speak the language, understand the culture, are respectful, and treat people with dignity. Medi-Cal plan procurement, super important for 14 million people in our Medi-Cal program. CalAIM, which really talks about care management and how important that is for people who have the most complex healthcare needs. Long-term care, which is the first time ever that I've sat at a table talking about universal coverage where benefits actually embrace long-term care. Coverage expansion. The important work the data exchange is. We have got to get a better system for sharing information, and I would argue that data exchange is as important a transformation as financing is. Office of Healthcare Affordability. We heard quite clearly from all the folks that we talked to in the field and in communities all across the state how important affordability is to a sustainable system and to them feeling like they can access that system. I would just say that what the report mostly calls out is just how bad our current system does at taking care of the most vulnerable in the state. It lays that out in a very clear way. Maybe we could have said more about that. But I would just say the status quo cannot continue. And if we didn't do one thing in this effort that I think needs to be done, and Bob alluded to this, there are many, many, many stakeholders in this system for whom the status quo is just fine. And if it's not just fine, it's just fine for them and for nobody else. And what we haven't laid out is all the obstacles there are to this kind of bold change. And I do think that moving forward, which we will surely do, and I personally and our organization is very committed to all of these principles, but we have got to get folks who are very comfortable with doing things the way they've always done them to move and to have the urgency that we heard from community engagement. And that requires a lot of work. Employers, small employers, large employers, hospitals, medical groups. And I don't say that because there's uniform opinion in any of those, but to say that the forces for status quo are enormous. Even as California's done so many amazing things, what is called for here is for us to make the tent a lot bigger with those folks who know the system doesn't perform well today, but want everybody else to change and them not to. And I would argue execution on all these initiatives, Mark, that you and your agency is leading, execution is super important. And we have got to build a bigger tent of those folks for whom they would prefer to keep their part of the system the same. I would just say we need execution, we need milestones, and we fundamentally need accountability to the folks in California who struggle every single day to get the care that we are capable of providing in California. And I think this effort takes us an enormous way towards that. It's been an incredible honor to participate. I want to thank the commissioners because I've learned a tremendous amount. And really, Secretary Galley, for you and your team, I really do tip your hat. You took a process in the middle of a pandemic and really tapped the capabilities and experience of this group. And you did that in a very agile and tactful way. And I'm deeply appreciative of your leadership. Thank you.
Thanks, Sandra. Jenny, before you go, I want to just say a deep debt of gratitude to you. I spoke to many commissioners before you joined the commission, and Jenny, your and I conversation always sticks out to me because you wondered what the main contribution you could provide to this commission. And I have to say, you saying yes is one of the best decisions. This commission could have had your contributions, not just your expertise on pace and in those delivery models, but just your compassion, humility, and ability to listen so clearly and well has benefited this commission. So just want to say that very publicly. Thank you, and the floor is yours.
Thank you, Dr. Galley. Thank you. I'm very touched by your opening comments, first of all, and to all of you. Yes, I did actually approach Mark and I said, are you sure that I have something to offer here? You know, I think that I'm not going to be your brightest point. And I am so grateful that I have had the privilege now of being a part of this esteemed group, working with our consultant group. And Mark, I want to underscore Sandra's last comment that you're leading this in the midst of unenviable backdrop, but the ability of your manner of listening to sometimes very tough comments and pointing us in directions that we may not have thought about, but you opened your tent much bigger to assure that we listened. And the part that this commission has opened, and a number of our commissioners who are wonderful advocates, to hear the voice of the people whose lives we would directly touch by the kind of policies in terms of their hopeful benefit for it. You know, I think I came into this looking for the hopefulness of a civil society, that this will come about as a result of this body of work. And I bring the dimension, as I thought, very narrow, and that is my 40 decades. Wow, that'd be a long time. 4 decades of time in working with older adults. Thank you. I've got a skin cream. The focus of older individuals in this, so often ageism is one of the other isms that has not always been talked about as much. And to elevate the aspect of long-term services and supports, which is in the report in a way that I could not have imagined. So I thank you so much for looking at this, because many people in the process of thinking about healthcare access and affordability may not realize until they come to that stage of their life or their family's life how social services and functionality and cognition become a much sharper edge that we have to look at. And the cost of these are things that bankrupt people who even were middle income at some point. So that we could do the math of what we would do without it and with it, and staggered 1 year over multiple years. That's a point of gratitude for elevating this, because I think it's one of those things like financial planning that we always put further ahead, but when it hits really big in ways not only about finances, but people's lives and the quality of their dignity toward that part of their life. I appreciated the comments that my fellow commissioners thus far have made about the excellence of thinking that we have to do into the policy, and the work that we're presented with, which is, I think, phenomenal. I wanted to just share with you, I was part of that period of time in Medicare where Part D benefit, the pharmacy benefit, was there. And I had a privilege of seeing what was going on in passing that piece of legislation. It was not perfect. We knew it was not perfect, but I'd rather have a half a loaf of bread than a full loaf, and we can then back it up further, which I have done. So execution, because I've been a part of delivery system change, I cannot speak more pointedly as to how important it is. Good ideas, but poor execution, poor implementation, it will not go any. So we don't celebrate just great policy. We celebrate impact when people's lives are actually touched. Finally, I'd like to make some comment on how important it is that the resistance that will come about is understood and appreciated. And so from whatever lens we come with as a beneficiary or somebody who isn't a beneficiary, somebody who is a provider, the policymakers and the payers all have to, I hope we do a mapping system as to what it would look like if we had access that was affordable and equitable. What would that mean for each group? What's our baseline now, and what could it look like so that we can identify what those roadblocks are in a more affirmative way and begin to have that dialogue that if we are to have a civil society, what it is that we have to address. And I'll do one final comment on workforce. Many of us have brought this up. I think the report does an incredibly important job of highlighting of context of culture and people who have oftentimes been left out. I also wanted to underscore a content area that we need people who are content knowledgeable. So not only framing from a cultural and respectful manner, but people need to know real stuff. The fact that older people oftentimes take 10 medications, pay a lot of money for it, but there's a lot of messiness that gets created because of those 10 meds. And we spend money, and if we knew content, that some meds aren't great for older individuals, we could save money and improve quality. So I just come at this with some degree of focus on execution and implementation. And I want to thank the state for both the governor's leadership, Mark, yours, and the legislature, who over these past 2 years in this report, we are aware of work that's going on data, on equity, on workforce. I thank you because you have actually seeded the soil with the kind of investments that we'll need to make sure we can pull this off. But thank you for the privilege of being here.
Thanks, Jenny. So that wraps up comments from commissioners in the room. We are, in my terrible job of keeping us to 3 minutes or less per person, we're a little behind, but that said, I want the commissioners to certainly take their full 3 minutes, those joining by Zoom. I'm going to start by going to Carmen first, and then I'll just hopefully make sure if I don't call you by the end, please let us know.
Hi, everyone. Hopefully you can hear me.
Yeah, Carmen, we can hear you. Great.
Okay.
There we go. Now we can see you as well. Perfect.
Okay. I want to first thank you, Secretary Galley, and my fellow commissioners. We knew when we started our work as a commission that if we did not fundamentally change our fragmented healthcare system, it's a system that allows profit-driven insurers and profit-taking healthcare corporations to thrive at the expense of Californians, that we would pay the price with our health and with our lives. And our work as a commission needed to be done with clarity, conviction, and with the utmost urgency. I have proudly represented frontline nurses throughout this commission and the pandemic. Nurses who dedicate their lives, and far too many of whom have paid with their lives to care for Californians and people across the country. And I have seen that I owe it to them to push and help our state to meet nurses' consistent demand for decades that healthcare be recognized as a right for all, regardless of ability to pay, without being tied to a job or immigration status, and regardless of whether an insurance company deems us to be a liability to corporate pocketbooks. And, you know, of course, I know that not everyone on the commission has had the same perspective as me. And, you know, I know that we have disagreements on the details. But I am a steadfast supporter of single payer. And I felt it has been my duty to ensure that we fulfill that part of our legislative charge to develop and present a clear plan for achieving single payer in California. In our final report, you know, the analytic findings confirmed numerous previous studies on single payer systems, that it would save patients and government money, and that it can do so while providing comprehensive benefits to all. And the report's appendices on federal waivers and ERISA confirm that there are legally reasonable paths that we can take and test on unified financing and single payer. And of course, like everybody else has said, the community engagement report confirmed that low-income Californians overwhelmingly support a single government-run healthcare system, and they support replacing premiums, copays, deductibles with progressive taxation to get us there. And you know, while our report highlights many of these things that we already know about single payer, the steps to get there, as others have described, are muddy at best. You know, and I think the report falls short of presenting clear, concrete, formal, not informal actions to get us to single payer. And I think, you know, the simplest way to describe it for me is that we bury the lead on single payer and its benefits. The report scarcely uses the phrase single payer at all. And instead, you know, we do this implicit reference to it through the direct payments model. And without listening to the dozens of hours of very, you know, robust conversations among all of us, without listening to those, you might not know from the final report that single payer was even ever discussed fully in commission meetings. You know, I recognize that a lot of people made a lot of contributions to the draft of from the draft of the report, and that there are improvements. But at the end of the day, you know, the commission's use of the term unified financing and other key terms, because we lack definitions, has always been opaque. And a major issue with our work is that we never came to a clear understanding of what certain things are, particularly the so-called intermediary option. And like I've said multiple times, I continue to underscore that a system that includes a role for health plan intermediaries is not and should not be considered unified financing, because fragmentation in the financing would continue. But the report conflates single payer systems with health plan intermediary systems under the umbrella term of unified financing. And fundamentally, without clear definitions of single payer unified financing, we cannot have a clear path for achieving them. You know, a few more points that I want to highlight is the report confuses some reforms, some of which we didn't discuss at all, of our current system as prerequisites to unified financing. Some reforms can be done at the same time. Other reforms may be more effective after we have a single payer system in place, or yet others described in the report would be obsolete if we had a single payer system. And, you know, I think as a commission, we also haven't given recommendations to the legislature, despite discussions about needing legislation to obtain federal waivers. And of course, you know, we did highlight the issue and importance of health equity, but we also didn't have clear plans for rectifying the ongoing problems with the lack of direct community engagement with low-income Californians, Californians of color, and other underserved communities in the process of redesigning our healthcare system. You know, all of this is to say that, you know, I see a lot of procedural problems and structural problems in the final report, among a lot of other things that I highlighted in my survey comments. And you know, I cannot with full confidence agree that we've met our charge as a commission So I just want to let you all know that I will not be voting to transmit the report. But I am still hopeful that the state of California acts with urgency and takes decisive, effective, formal steps to lead our state and our country to single payer. The final report falls short of providing the necessary ignition that starts us down the road to universal healthcare for all under a single payer system. I, of course, am truly and deeply appreciative of all of my colleagues on the commission. I absolutely, appreciate every conversation that we've had. But, I also want to recognize, and I am truly in awe of the dedication of the members of the public who have stepped up in the past 2+ years as a movement to sincerely answer every question and concern about the policy of single payer that has been raised during this commission. And I think together we will keep on fighting to ensure that California acts urgently to transform our profit-driven healthcare system, our fragmented health insurance system, into a single payer system that prioritizes patient care where everyone is finally in and nobody is out. And with that, I want to thank you all again. I deeply appreciate all the work everyone has done, and thank you.
Thank you, Carmen. If we could go to Kara Desert next.
Good morning, everyone. Can you hear me all right?
We can.
Okay,
Great. Now we can see you as well.
Okay, great. I want to start by thanking the leadership of Secretary Galley and the staff and consulting team. This report is not perfect, but it is strong, and it's a culmination not just of this commission's work, but on so many shoulders that we stand on who have strove to make California's healthcare system better for so many. We know that the fragmented healthcare financing here is a broken system, that it hurts marginalized and excluded communities, those who are low income and those who need access to healthcare the most with deep healthcare needs. We know that we have a deeply broken system that is too expensive, too complex to navigate, rife with inequity, especially in a state as diverse as California, and is inefficient. So we have some good news that with unified financing, we have an unprecedented opportunity to fix the system and make it better for so many, make it more affordable, make it more efficient, make it more equitable, and make it more accessible. The urgency here is that we have both an unprecedented opportunity and a risk of deep harm if we choose to stay in the status quo and not move forward and act. As this report outlines, there's a cost to inaction. Under the status quo, we would increase the cost of healthcare over the next 9 years by $160 billion. That's a 30% increase. And so, given that truth, and I appreciate the urgency in this report that we cannot wait. We cannot wait to enact some recommendations and to move forward. I echo Commissioner Hernandez's comments that we must build a bigger tent to make these changes real. The way forward is not an easy one, and we will need all of us to make this change real for California. We will need our communities, we will need our voters, we will need our government, philanthropy, business, and our healthcare systems to make this system remarkably better for all of us, to be a national leader that charts a groundbreaking path forward to truly improve the lives and the healthcare for Californians. And so, I just want to say it has been an honor to participate in this process. I send deep gratitude to Secretary Galley for his leadership, to his staff and consulting team, and to the brilliance of my fellow commissioners. This has not been an easy path, and we don't agree on everything, but this report charts a path forward for California to be brave. And we need to be brave to make real change in the lives of those who need us most. California is counting on us, and the nation looks to us for our leadership to truly chart forward a path to make healthcare remarkably better. Thank you all so much. I'm honored to be a part of this commission and want to thank everyone for all of your hard work and partnership. Thank you.
Thanks, Kara. Next, I'd like to go to Richard Pan.
Thank you, Secretary Ghaly and commissioners. First of all, I just want to echo what our previous commissioners had said about the work of this commission and also the discussions that we've had. So again, appreciate the space and the opportunity to have the discussions we've had. Certainly there's a lot of items in the report, but I think I'm just going to highlight two particular things related to the report that I'm hoping that we can continue to work on. First of all, certainly we've had a lot of discussing about financing. This is the thrust of the report's about unified financing. I think if we truly believe healthcare is a right, and that's often a statement being made as a reason for having unified financing or single payer system, then there also needs to be a very clear commitment that the financing for this system that we're proposing or whatever evolves is an entitlement and free from annual appropriations. As someone who was in the legislature during the Great Recession, where our Medi-Cal program, which is our state single payer system, there were proposals to, for example, limit the number of visits to 10 visits, no matter what your condition. You have people on dialysis who need to go in for dialysis multiple times a week, and I don't know how 10 visits was supposed to work. So we cannot have that kind of event happen just because there's a recession. If everyone's in the system, then there needs to be commitment that it's an entitlement and that it's not going to be actually subject to the whims of frankly, the situation. And because if this is truly healthcare is a right, then it needs to be treated as a right. So, we have a lot of discussions in the report about, federal, state, et cetera, funding, and, eventually whatever gets worked out, but there needs to be a commitment that whatever it takes, if we're going to require everyone to be in the system, then it needs to be financed in that way as well. There's going to be a commitment that it will be financed then. Otherwise, which gets to my second point, the equity issue. And again, I know we've had some excellent discussions about equity. We also know that in periods of, and I've seen this firsthand, I'm a child of immigrants. I'm one of a person of color on this commission. One of the few, I lead the caucus representing the API community. We know that when crunch time comes and resources have to be distributed, oftentimes the most vulnerable get the short end of the stick, right? Medi-Cal is one of the lowest payers in terms of payments. We know that California's Medi-Cal program has one of the lowest, historically been one of the lowest paying of any of the state's Medicaid programs. We need to do better. And frankly, the pandemic has taught us some of the challenges, equity, in building political will for equity. For example, a research study came out that showed that when there were more stories about inequities and who was dying of COVID, there was less support for public health measures. When people thought, oh, it was those people who are dying, not me, not my family, because I'm well off, we had less support for public health measures. And we actually are seeing that right now in some of the actions that are happening across the country. So equity is hard. It's difficult. I know all of us here know that because many of us have been in the front lines. I've committed my clinical career to taking care of primarily Medi-Cal patients, communities of color, disadvantaged children who can't vote. And so we need to be sure that in the governance, in other aspects of this system that we evolve, that equity is front and center, not as a performative piece, but that we actually truly possess equity. So I would just, again, thank everyone for their work and again, emphasize healthcare is a right, therefore finance it that way and ensure that every community has a voice and that we truly have equity in whatever we're putting forward. Thank you.
Thank you, Richard. Could we now go to Andy?
Thank you. All, can you see me, hear me?
We can hear you.
We're good? Okay.
And see you. Great.
So I'm going to be brief. Hopefully you can make up some time. I want to thank the governor for appointing me. It has truly been an honor to serve. I want to thank my fellow commissioners. You have taught me a lot. I particularly want to thank Mark for getting this done under what are clearly difficult circumstances. The consultants, world-class, first-in-class work there. I think a lot of people inside and outside the state will benefit from what you've done. I am going to be proud to advise the referral of the report. I just wanted to make a couple of quick observations. So, just keying off on Commissioner Pan's remarks, the importance of entitlement in terms of the federal government's understanding of any final agreement with California just underscores that this can't be a California to the executive branch understanding. The Secretary, I don't think, has a magic wand. There's some dispute about that. But even if the Secretary had a magic wand, you wouldn't want to be relying on the Secretary's magic wand. It's just not a stable enough situation. And anybody who's watched what's happened in Medicaid waiver land over the past 4 years will understand exactly what I'm talking about. So I think the report could have been stronger on California needs to get the federal government, both the Congress and the executive to buy in on entitlement, as well as a number of other issues. I don't think the report gives enough weight to all the work that's going on in California now to move the ball forward on a number of fronts. And I think that should be that should have gotten more emphasis and more credit, because from a national level, very few people are doing what you're trying to do, and you need to push forward on those fronts, and everybody needs to understand how important and how potentially game changing they are. And last point, I would have appreciated a little more emphasis on transparency, particularly with respect to the performance, both financial and quality of care and access of the managed care plan, and whether that's in Medi-Cal or in Covered California or CalPERS or Medicare Advantage. As Richard Scheffler has pointed out, we're in an intermediary land. Some of us don't like it, but here we are. So let's make sure everybody knows how they're performing. Because if they know that everybody is going to know how they're performing, a lot of them will up their game. That's just the reality. And right now we don't have the level of transparency we need to get accountability on the part of the plans. And with that, thank you very much for the opportunity.
Thank you, Andy. Could we now go to Bill?
I want to thank Mark and the governor for the opportunity to serve on this commission. It's a privilege to work with the other commissioners, and I learned a great deal from it. I would like to just give two reflections about the commission's work in the report. California has the inequitable, ineffective, and the inefficient health, and other commissioners already said that. And I would just like to add, most California residents suffer higher costs the inferior quality health care from this poorly performing institution. That should be emphasized. Our commission confirmed universal financing is a much superior system. And I'd like to add, though, the poll conducted shows that more than 70% of Californians want an overhaul of its healthcare system. So there's a strong grassroots support there. The question is, how do you actually make that really more powerful than what it is now? The second point I like to make is the key question facing California is how to move the current effective system to universal financing. The question how is not what. I think everyone can agree we should move to basically a unified financing system, whether you call it a single payer or California want to call a new term. I call your unified financing is basically a single payer system. So but with that said, is the commission move the ball 10 yards or 20 yards or 30 yards for the goal post? I believe the answer will answer by history. The answer of that depends on how the governor and the secretary of HHS carry the ball forward and move it. In other words, how are you going to implement even the several major onward steps that's laid out in the commission's report? The words are there, but they're vague, ambiguous. No deadline, no benchmarks. So I emphasize really the next step California should look after carefully is the implementation of what's or the commission even proposed and laid out. So finally, I just want to say a few words about where we are. I will say, regrettably, California is still quite far away from the unified financing goalpost. This is based on my work in 9 other countries developing their single payer system, as well as for Vermont. California still have a long way to go yet. So further major efforts still needed. That's my conclusion. Thank you very much for the privilege serving on the commission.
Andy and Bill for participating from the East Coast, always flexible with the time, taking calls much later than most of us have to tolerate. So really grateful for your overall contribution. And Bill, to you in particular, you sort of kicked us off in our new way of having our meetings. Initial presenter did it more than once, really dug into your wealth of experience and knowledge and commitment to not just this issue in an academic theoretical way, but in its deep application to how it can improve California. And knowing that we have a ways to go, just very grateful for the ongoing contribution. Antonia, if you're on, I'd love to turn to you next. I think, Antonia, you need to unmute, I'm being told.
Can you hear me now?
We can. Great. There we go. And see you now. Perfect.
Okay. Well, thank you. And I think I'm close to the last, so I won't prolong it. First of all, thank you, Secretary, the staff, and the consultants for a very good report. It's not perfect, but we can't get perfection get in the way of the good. What I would like to say is what Sandra and others have said is that there has been many, many people that have worked before to get us to where we are. And it's going to take many, many more people in the future to get us to the ideal. My point, and as most of you know, I don't come from the healthcare field, so I don't know as much, but I do have some experience in implementing public policy. And I think that the report does a very good job of giving us a pathway to get there. We should not get caught in the minutia of how, because through the legislative process, there's going to be a lot of changes. What we need to do is stay focused on the end goal. And California can be the model, but I would say that in some way, members of this commission should come together to see the execution of the plan. You need the urgency, you need focus, and at the end of the day, I think that this report does a very good job of giving us the roadmap for us to get there. Unified financing in whatever form would be a better way than what we have today. So my closing comments is thank you for the privilege of serving. And I would say that execution of the plan is the most important part. And I urge you, Secretary and the Governor, to find a mechanism to have some focus on getting this done. It's urgent, it's needed, but it's going to take some time. And I really appreciate that the barriers or the obstacles that need to be overcome and dealt with are there. And that's what we need to focus on. So thank you very much.
Thank you, Antonia. Next, and I believe last, I want to turn to Jim Wood. And before Jim goes, I just want to say particularly thank you, Jim and Richard Pan. I know it isn't easy to have all of the different hats on at once, and you both did a tremendous job of being effective, clear contributors to the commission's work. And I believe all of us in our positions in government did learn a great deal. So thank you for always participating with the grace and integrity that you both did. But Jim, I believe hopefully you're up.
Thank you. Thank you very much.
Great.
If I'm, oh, there I am. Okay. Wow. That's kind of big. Wow. Okay. Anyway, first of all, I just want to thank once again, it's been said over and over, but the consultants and Mark, Secretary Ghali for this. What I think is really admirable was the shift that happened. The fact that there was a recognition that the process as it was originally laid out wasn't working really well. And the shift, the change in the way the commission operated was, I think, really critical. And I think it really had an impact on the outcome of the report. There is no such thing as a perfect report. If there was, it would. I haven't seen it yet on anything we've worked on, but it is a roadmap and it is critically important. As a legislator, we are focused on individual pieces of this at times, and to see a big picture approach, I think, is really, really important. There will be a significant changeover in the legislature next year, in excess of 30 new members, and that will change the way policy is looked at, possibly. But it will certainly be a different cast of characters, so to speak. And from my perspective, getting to know all of them will be a big part of how we are successful. I do want to go back to a couple of things that I think are really important, and I really do appreciate that this has been brought up by multiple people. the focus on cost and how we find a way to get our arms around slowing down the ever accelerating, it feels like, costs of healthcare are really, really important. It's why I've focused so long and hard on this in my work, and am honored to be working with the administration and the governor on the Office of Healthcare Affordability. The pushback from people to maintain the status quo cannot be ignored. It is significant, and they are very influential. And so it's important that you recognize that and that we find ways to engage on that. This also goes for our look at works on, as it was mentioned by Richard Scheffler, about consolidation and mergers and acquisitions, and how do we get our arms around that? The resistance to even a little bit of oversight is significant, and that is also a challenge for us going forward. And then a final piece of that, then these are things that I've been working on, which I think are continue to be important, is around health data information and how we can, if we're going to get a system, a single payer system in California, we have to have a system that allows for the free exchange of health information, so that providers have access to that on a statewide level. And you can't do any of this without two major things happening. One, a focus on a strong primary care component, absolutely critical to being able to pull this off. And the second one has just escaped my mind, but it was really important, but sorry. It happens. We've got a lot on our mind. This is a busy week for Senator Pan and I, and so we've got a lot going on. But the focus on primary care is really critical. The second focus, and it came back to me, and this is what will forever be indebted to Senator Hernandez and California Healthcare Foundation for the Workforce Commission that was convened in 2017, and the work that's come out of that. And I believe it has been really critical in how we look at workforce. And thankful to the governor for proposing a huge amount of resources towards workforce. It's our job to focus that in where it needs to be. And it isn't just about creating workforce, it's about getting workforce to where it needs to be. And that is always something that I'm going to fight for. Representing a largely rural district, it's hugely challenging to get workforce where it needs to be. And we fight that every single day. And that's why you see me fighting for more flexibility in how care is provided, by who provides it, because we simply won't get it otherwise. And that's a constant battle. So recognizing it's not a perfect report, but it is hugely important. And I would encourage everyone to engage with members of the legislature, build those relationships early, so that we can move these substantive policy issues forward. And I thank you very much for the opportunity to participate.
Jim, thank you so much for acknowledging the busy week. I want to call Ana Manasantos up, a really amazing champion for the work that this commission has done, to say a few words. But before, Ana, you go, I just want to make two really important observations. What I heard loud and clear from the commission is what my mother has told me my entire life. You weren't perfect at all. You really have a long way to go, but it's always important work forward. And then for the first time, I think in my... Oh, yeah, don't remind me. And then the second thing is, for the first time in my life, I think I'm the only male wearing a tie, which is shocking to me. All of you know tie. Very good. All right, Ana, please.
I don't know about perfect reports, but Mark's mom's Kanefa is perfect. So anyway, I just wanted to come and say thank you. I know that doing this work during the easiest of times is super challenging, just based on the substance and just how deeply personal this is for all of us. Doing it during the times of COVID is even more challenging. So really appreciate all of you taking this on, staying with it, and really appreciate that we're going to be the beneficiaries of your good thinking and your good process and community engagement, and the work of all of you, the work of the consultants, and really, really deeply appreciative of that. Really like the approach that you've taken in terms of kind of thinking around how do we make progress towards a unified financing system now. What are the things that we need to do on the workforce front? What do we need to do from behavioral health? How do we keep doing more and making more progress on transparency, on cost, on equity, and on making sure that all of the lessons in COVID that we've learned in the most painful way possible translate into improvements for our healthcare delivery system going forward. Appreciate the importance of our work with the federal government, and we have our work cut out for us, and we are appreciative for your good work and the roadmap that you provide and all of the important questions that you've highlighted. And really grateful for Mark, as with everything, the way in which he does the work. Really loved reading your letter, and reminder of how the personal really informs all of what we do, meshing that with the analytics, the challenge, and how, if we were starting over, we'd probably be doing something different. But one of the things that I think you've done that is really critical in terms of both talking about how we get there is also being really clear about the price of inaction and the importance for us to do everything we can to embrace this, to do the hard work, keep rolling sleeves up, and keep moving. So anyway, thank you all. Appreciate it.
Mr. Chair, just one comment for our colleague. And it's great to see you. By my count, you've probably served 3 governors by now, and really well. And no one in the state of California is probably as familiar with the intersection between health policy and budget policy as you. Now, I'm giving you that compliment for a reason, right?
It's always for a reason.
I would like to see, Mark, if there's something we can do in the implementation that gets us ever closer to the next step of Medi-Cal expansion, to try and get from the 92% coverage, or where we are now, 93%, where are we at, Richard? To closer to 100%. And whatever we can do and not have to wait for the federal government to give us permission to do it, I would like to see that explored. Thank you, Anna. You're a great leader. Appreciate you.
We will keep working on that.
Thank you.
Thank you.
Thanks, Anna. I know a lot going on, but your leadership and your, frankly, partnership and support has been important to allow us to get to this place. And I'm personally indebted and grateful to you, especially given my newness to Sacramento and the help that you've provided to me to get through not just this opportunity, but many others. Before we open to public comment, and I did such a bad job facilitating time. We're about 25 minutes over on this part of our conversation. And that said, I do not want to take any time away from public comment. So I'm just going to ask commissioners. I haven't asked often. We've ended on time every other time, I feel, but this time we're going to go over just a bit. Rest assured, the WebEx will stay open until 1, so we'll have 15, 20 more minutes of conversation. I want to just take a moment to summarize a little bit of what I heard. And one word that I think about, Bill, you used it. It was the word power. And I think of the power of this commission. It's been very powerful. I think it's been powerful to me personally. I think it's been powerful to all of you. And the way we've done it, I'm proud of, because I think that power was unleashed by the way we did our work, the way we engaged one another. And I'm just deeply grateful to all of you. I also think about the power of engagement, the community engagement part of the work, the engagement on so many issues throughout the pandemic that this commission spoke about, I think was very important and powerful. And one of the most important pieces of that engagement work was just the discussion about power and the fact that what anchors so many of the inequities that our state faces is that power dynamic that must be shifted. And as much as we think about healthcare as a system where that power imbalance exists, and I think we all spoke and heard about that. I think the idea of a healthy California for all, it wasn't a healthier healthcare system for all. It was a healthy California for all. And the healthcare system has a lot to do with our health, but it's not the only thing that matters. And as I think about how we take the next steps of implementation, as we take the roadmap steps in this report, assuming we vote to transmit it, I think you hear from me loud and clearly the commitment to working to broaden the tent, as you said, Sandra, to invite many more people into the conversation, to look for that A team, that LeBron, Steph, Kareem team, to think about what our roadmap looks like and to make sure that we do it in the way the governor talks about, that California way, that really does look to be inclusive and broad in the work. And that can't happen by one agency alone. It's going to take a great deal of rolling up the sleeves, and I'm just grateful to my co-commissioners for your contribution, for your help teaching me so many things along the last 2 years that I really do believe we've tried to implement some, not all, because it's not possible to do it all in a couple of years, but that we have an idea of where we go next. I just want to take a moment before we start public comment to acknowledge, and I'm grateful of the commissioners who acknowledge the tremendous work of the consultant team. Yeah, and I feel like they had to tolerate long Zooms with me, asking lots of questions. Marion, you always asked, how could you help me? And you always delivered. And I just want to take a moment and thank Ken and Eric and Karen. And beforehand, we had Alice Chen helping us. We had Andy Beinman on the team. We have Bobby Winch, who isn't here with us today, but played such a critical role. Rick, I want to thank you personally, Marion. You shouldered, especially recently, the heavy burden of tolerating me and working through so many different pieces of this work. And then Vishal, you have been a star in so many ways, and I'm grateful for not just your smarts and chops to do this work, but that deep commitment you have coming from California and bringing your work. Richard, you should be proud if all of your students turned out like Vishal. Maybe the work would be a little bit closer in hand, but Vishal, really just deep set of gratitude to you. So without any more comments, I think we're ready to go to public comment.
Thank you, Secretary Galley. So yes, we will begin public comment in just a moment. Just to tee that up in a moment, I'm also going to show a slide that shares how the public may provide comment on the report. But just to preview the public comment period, again, if you'd like to provide comment either verbally or through chat, you'll need to be on the WebEx platform, the link of which is found on the agenda on the Health of California for All webpage. So first, let's take a quick look at the process for the public to provide comment to the report. If we can share that slide. Great. Thank you very much. So members of the public, you have an opportunity to submit comment on the final report as well. And as you can see from this slide, there are some standards that need to be met in order to do so. First, you need to submit your comments no later than May 20th. Your comments need to conform to the basic standards we've set forth thus far. Please submit your comments to Healthy CA for All at chhs.ca.gov with the subject line, Comments on Key Design Considerations Report. Your input will need to pass the accessibility screen. Please do not include attachments, though you may include web links that are viable. And of course, please include the author's name and any organizational affiliation that's relevant. Okay, moving on to public comment. We will be taking comment from both individuals who are physically in this room with us today, as well as those who are on WebEx. We'll be opening up the chat feature as well. If you are in the room and would like to comment, we have 2 microphones at the front of the room. Please feel free to come stand at those microphones. Make your comments, please, no longer than 1 minute so that we can afford everyone, I think mostly virtually, the chance to comment as we have time for. If you're here in the room and have made a verbal public comment, when you're finished, please come to the closest sign-in sheet on the stage and fill out your first, last name, and organizational affiliation, as well as mentioning it verbally when you begin. So we'll afford members of the public in the room to do that now, and then we'll turn to those virtually. And for those virtually, we'll be looking for the virtual raised hand, which is by clicking on the participant panel and then seeing the virtual hand icon at the bottom. Okay, please welcome.
Commissioners, Ian Lewis, National Union of Healthcare Workers. I want to express my appreciation, Secretary Galley, especially to you for shepherding this to the conclusion it has, and to your analytic team. As you said, before this process, legislative analysis couldn't agree to the nearest $100 billion how much we're spending on healthcare today. Now we know not just that, but how much is coming. Assemblymember Wood had a tsunami warning in his background. It's an apt metaphor, $158 billion of unfunded mandate that's coming to households in California through increased taxes, reduced wages, increased out-of-pockets unless we enact single payer. That is a catastrophic impact. It's a dry statistic, but it is increasing housing insecurity, income insecurity, food insecurity. There's no more compelling case to move. You asked in the report to assign staff to engage the federal government and move policy matters. Can't happen sooner enough. Thank you.
Thank you very much. Is there anyone else here in the room? That was completely on point, on time. Thank you so much. Any other individuals who are here physically in the room with us that would like to provide verbal public comment? Okay, well, with that, then we'll turn to the WebEx platform. I'm looking for virtual raised hands. And I'm looking now, just trying to find an order of the queue below my, here we go. All right, so we're going to invite individuals one by one. I'll state your name and invite you to unmute. And again, please keep time for 1 minute, and I'll gently let you know that your time is up, and let's please afford others their opportunity as well. Please state your full name and any organizational affiliation. And with that, I'm going to open the line to Judy Jackson. Please go ahead.
Yes, this is Judy Jackson. I'm a 76-year-old resident of California, beneficiary of both Medicare, Medi-Cal. I am working with the California Nurses Association and the California for Retired Americans organizations. And my comment is, I just want my medical decisions made by medical personnel, not insurance companies. And I would like just one procedure to follow, not one for my prescriptions and one for my doctor visits and one for my hospital visits and one for general medical assistance. Thank you.
Invite to unmute. Oh, there you
Hello,
are. Is that you, sir? Please go ahead. Hello.
I don't hear a name, but my name is Jeffrey Tartagia. I'm an advocate, and I'm involved with both nurses and HCA and a number of other homeless and other things. And I will say to Dr. Galway, as I've said to him with the Master Plan of Aging, that The single thing that is missing is the individual here, the client. You need to incorporate that opinion in there. And as far as you've gone gone nearly far enough. That is my comment for this board and this panel. And yes, I will still continue to advocate until we get the best system in equity and in situations like this. Thank you. Bye.
Thank you. Thank you very much. Tracy Rattray, we invite you to unmute. Tracy, we still cannot hear you.
Hello?
Hello, please go ahead.
Okay, thank you so much. Hi, my name is Tracy Rattray from the California Alliance for Prevention Funding. Thank you for this opportunity to comment. I'm thrilled to see that addressing the social determinants of health has been mentioned by both commissioners and participants in the community engagement process. The closest the report comes to actually addressing them shows up with, quote, the impact of the commission's focus on healthcare would be enhanced by additional steps the state can take to address social determinants of health. A concrete step the state and the commission could take right now is to support a budget request to establish a health equity and racial justice fund in California. Thank you.
Thank you very much. Patty Harvey, we invite you to unmute.
I don't know if I am unmuted. I don't see.
No, please go ahead. We can hear you.
My name is Patty Harvey, and I represent the Humboldt County chapters of Healthcare for All and Physicians for a National Health Program. And I just wanted to comment on Richard Scheffler's comments on fee for service. They are misguided and not basically untrue. The claim that capitation would save money has no data to support it. In fact, it is capitation that allows for so much fraud and waste. Look at Medicare Advantage and the many, many other private health insurance companies that have been indicted and fined for fraud and abuse that produces for them obscene profits to the extent that punishment is merely a cost of doing business. Fee for service is much easier to oversee and control. Thank you.
Thank you very much. Doug Major, please go ahead.
Hello, can you hear me now?
Yes.
Thank you so much. Doug Major from the California Children's Vision Now Coalition. Just want to remember our youngest members of the citizens in the audience, and I would suggest that access to children's vision care in California is maybe one of the biggest problems that we face as far as the loss of human capital and economics. We sure appreciate your efforts, and would hope that you remember that children's vision care should be a part of the essential health. Thank you.
Thank you. Bill Honigman, please go ahead.
Hello, can you hear me?
Yes, sir. Please go ahead.
Yes, thank you. My name is Dr. Bill Honigman. I'm a retired emergency room physician from Orange County. I think we can all appreciate now that a single payer system without commercial intermediaries will best provide the most comprehensive care that will be both more efficient and more equitable than what we have at present. And COVID-19 has shown us the imperative to take action to effect these changes now. While many still suffer from this pandemic, and many more will suffer from those pandemics yet to come, and other public health maladies that we'll see, in particular, climate change. Please move this report to the governor and the legislature now with no further delay, while we can still save so many lives and so much money that can be used for other public needs. Thank you very much.
Thank you. Pilar Chavo, please go ahead.
Hi, Pilar Chiavo from the Healthy California Now Coalition, representing millions of Californians and organizing to guarantee healthcare for all. We want to thank the Commission for your hard work and are very encouraged by this report. While, no report, as everyone keeps saying, is perfect, we don't want to bury the headline that this is big, that this California Commission has put together, that was put together by the governor and legislature, finds that we can save $500 billion over the next 10 years with a unified financing system. It saves thousands of lives and brings equity to our healthcare system by guaranteeing healthcare. We must dedicate resources to start negotiations with the Biden administration as quickly as possible. Time is of the essence to move things federally, and we want to support that work. We must start working on the next steps now. And finally, we ask that you be brave. The price of inaction is lives lost and billions wasted. We understand the power of the opposition and need to confront it. As an organizer for 2 decades, I've seen everyday people stand up to power, to corporations and political machines and win. When we organize and are unified, we can win. We are here for it. We look forward to working with you and making sure California guarantees health care for all. Thank you very much.
Thank you. Kristen Golden Testa, you're next, please.
Hi, this is Kristen Golden Testa with the Children's Partnership. I wanted to thank you all for your work and dedication on this issue. And I wanted to provide 2 comments. One was relating to the benefits. I know it was not a main conversation or topic, but I did appreciate that you noted that a comprehensive benefit package like Medi-Cal would be important. And I just wanted to note that it is very important for children, given that they do have a very specific EPSDT full comprehensive benefit there, and we wouldn't want to lose that in trying to equalize it to other types of coverage. And then the second point relating to social drivers of health, I would recommend inclusion of the promotion and funding of accountable communities of health as important vehicles for the connecting of communities, one as a sharing of power and equity, but also because they are more on the ground and know what some of those social needs are and should be part of the mix. Thank you very much.
Thank you. Arthur Chen, please go ahead. Oh dear. Arthur Chen, please go ahead.
Hello?
Mr. Chen, as you may be able to hear, we got some terrible feedback when you unmuted, so my apologies. We're gonna move on. Please do submit your comment in chat, I hope, or via email. Let's move on to Betty Toto. Please go ahead.
Yes, hi, Betty Dumas, Toto. I am a volunteer with the Poor People's Campaign of California. There is a myth of a scarcity in this country and even in the state when it comes to providing the necessary fundamental needs of the people. We live in the richest country in the world, and California is the 5th largest economy in the world. There is no doubt we can afford to provide health care for all people in this country and in this state as a right. In California, we lost $20 million to unemployment fraud and still came out ahead with a $23 billion budget surplus the year of a pandemic. When people were and are still losing their lives to this deadly disease, we are still in committees debating if it is affordable to provide health care for all. I don't get it. How farcical is this committee convening on financing with a main focus on the dollars in this light? The focus of this commission should have been on the social determinants of health care and how our abundance can address those issues. We all know that a single-payer healthcare system would meet the Commission's concerns of affordability. Single-payer systems have been tried and true in other countries. Single-payer has been researched over and over again before this Commission even existed as a healthcare model that saves money and saves lives.
Thank you, Ms. Toto.
The Commission's conversations would have done more service to Californians had it focused on the social determinants of health.
Thank you, Ms. Toto. We'll need to move on to our next public commenter, Francesca Wander. Please go ahead.
Yes, my name is Francesca Wander. I am a member of California State Strong Indivisible. I have a personal story to share. I will hope to do so without crying. I have a friend who quit her job 3 years ago as a 19-year high school science teacher because she had no other way to take care of her 89-year-old mother who suffers dementia. She spent the last 3 years depleting what small savings she's had, washing her mother, bathing her mother, feeding her mother, caring for her mother, clothing her mother for the last 3 years, because nursing facilities will not take Medi-Cal patients. They'll take expensive private paying insurance patients only. She then just recently got evicted from her home of 7 years so her landlord could sell her house. She had to find emergency shelter for her mother because she couldn't have her mother become homeless with her. And the only option that was presented to her from all of our social agencies was to literally abandon her mother at an emergency room hospital, whereby the emergency room would be forced to find a placement for her. And they then shoved her in the back of an ambulance and took her to a place down in Anaheim, where she has no access to her daughter or her daughter to her anymore. The fact that we are still discussing this after 10 years is deplorable.
Thank you.
Get it done.
Thank you for your public comment. At this time, we need to move on to the next speaker, Beatriz Sosa Prado. Please go ahead.
Good morning. My name is...
Hello.
Yes. Do you hear me?
Yes, although your volume's a bit low.
Okay, I will do my best. Good afternoon. My name is Beatriz Sosa Prado. I'm the Executive Director of the California Physicians Alliance. And CAPA advocates for a universal healthcare system in California. And we work with California legislators to advance bills that improve our healthcare system, as well as with Covered California to get people healthcare now. Thank you to all commissioners for your efforts in finalizing this report to the governor. And though the report is imperfect, we now have something that will help advance California's healthcare system. CAPA will continue to work with everyone and anyone who is willing to work towards a California that provides a healthcare system that is universal, equitable, affordable, comprehensive, and sustainable. CAPA is not focused on calling the system one way or another, but the imperative here is to ensure that everyone who calls California home has access to a high-quality healthcare. Thank you.
Thank you so much. We have a name, Elsa Schaefer, but we understand there's no audio. Elsa Schaefer, do you want to quickly just confirm that? Okay, yeah, as we thought, we don't believe you have audio for speaking, so if you could provide your comment via chat or email, we very much welcome it. Next is Elizabeth Connors Keith. Please go ahead.
Hi, can you hear me?
Yes.
Okay, good. I'm a member of Healthcare for All California, and I want to emphasize that, or restate what Carmen said, that the report is mixing together systems that are, have like health insurance plans with single payer under the title Unified Financing. By definition, a system can't be called unified financing if there's room for multiple middlemen to manage healthcare dollars. These lumping them together is just confusing, misleading, and it's obscuring the real issue. And the fragmented system is more problematic than a true single payer system. It's hidden in the footnotes, buried in the footnotes, that a single payer system would save billions of dollars more each year than a fragmented system that has a role for health plan intermediaries. These middlemen do not add any sort of value. Okay, thank you.
Thank you. Appreciate your respect of the time. Kayla Westergaard Dobson, we welcome you to speak next.
Hi, my name is Kayla Westergaard Dobson. I'm a CalCare advocate in Los Angeles. Thank you to the Commission for the work over the last 2 years and for this final report. I want to commend the Community Voices section in particular, so thank you very much for highlighting the fact that Californians want single payer, and we all feel the urgency of ending the profit-driven healthcare system right now. I've shared my story and that of my son Arthur's with the Commission before. He died as an infant in 2020, and dealing with our fragmented, predatory private system has been as traumatizing as my son's death. And my story of medical trauma at the hands of private insurance is one of millions. Our public deserves lives free from middlemen, free from third parties and insurance boardrooms denying us health care, profiting off our pain. We need single payer, and the Commission's final report contains no clear recommendations to the legislature, nor does it recognize that legislation is a key step on the path to single payer. The first step in moving to the system that we need, the system of unified financing, is to pass a policy bill. The Commission should more clearly highlight this in the final report so we can all move forward towards our common goal of single payer together. Thank you for your time.
Thank you very much. Angela Gardner, we welcome you next.
Yes, can you hear me?
Yes, we can.
Hi, I am Angela Gardner, and I work with both Cal Nurses and Hand in Hand, part of the the Domestic Workers Alliance. I am disappointed that the report does not have a clear plan to develop and implement universal single-payer health care. We need legislation to implement it. Universal financing must be transparent and include the disability community and the organizations that represent them in the process. It is not included in the report. Nothing about us without us, and long-term care services and supports must be included. Thank you very much.
Thank you. Paul O'Rourke-Babb, please go ahead.
Hello, can you hear me?
Yes, sir.
Okay, I'm Paul O'Rourke-Babb. I am a 36-year career practitioner whose career was abruptly ended by a healthcare catastrophe. And I lost my house and had to move out of the state as a result. But I've spent 30 years working on what you're working toward, and I can tell you that single payer, publicly financed healthcare has been proven to be the solution. And intermediary land is a failed system. It's a failed solution for a failed system. So please move the ball forward and give patients and clinicians the tools and the financing that they need to create a truly universal, accessible, affordable system. Thank you.
Thank you very much. Robert Skinner, please go ahead.
Hello.
Oh, we heard you for a minute. Please
Hello,
try
can you
again.
hear me?
Hello, please go ahead. Yes.
Okay, thank you very much. My name is Robert Skinner. I live in Atascadero, California, and I'd like to thank all of the people on the commission for their hard work. I'm very encouraged by a report. It confirmed that single payer will save billions of dollars for Californians. It confirmed that it is an efficient system and that it will save lives. Your report also provides a legal analysis that states legal waivers will not be needed to change federal laws. That is key. That is important to financing a single payer system. And the most important thing about your report is that it under the community voice section, it makes it clear that the public not only wants, but it demands a single payer system. Thank you for your good work, and Medicare for all, CalCares for all.
Thank you. Stephen Milosky, please go ahead.
Let's see, I guess, am I on?
Yes, you are.
Okay. I'm a physician in California. I worked for EDS as a payer, the fiscal intermediary for a decade, and I also have worked the Indian Health Services, and I practiced in California for 20 years. I get my care from the VA as an entitlement for disability. I have a couple comments that I think that in what I've done, the things I've seen, a lot of unnecessary care is done, and it costs a huge amount of money, whether it's in the private sector health plans or otherwise, and whether this system comes to pass or not for single payer and unified healthcare financing. The problem is things are done at the point of care. Thousands and millions of things are done daily that generate all kinds of claim lines for things that shouldn't even be paid for.
Mr. Milosky, you've reached your time.
Okay.
Thank you.
All right.
Thank you very much. We have CT Weber up next, but with no apparent audio connection. So CT Weber, we invite you to submit your comments via chat or email. We're going to move to Richard Dawson. Please go ahead.
Hello, my name is Richard Dawson. I'm a resident of Los Angeles. Your data, as well as numerous other studies and actual implementations in other countries, show that a single payer system is the most fiscally sustainable way to provide quality health care to Californians. Yet your report dares not even speak its name, let alone lay out a plan to achieve it. This is a missed opportunity.
Thank you, Mr. Dawson. Nancy Greep, we invite you to go next, please.
Can you hear me?
Yes.
Okay. I am a retired internist and a member of the Physicians for a National Health Program. I wish to make 2 points. First, I take issue with the Commission's conclusion that there is not much difference in health expenditures generated by a system involving intermediaries and one which does not. Numerous economic analyses, including the Congressional Budget Office, show that the main reason single-payer systems save money is by the elimination of insurance companies which add huge expenses to healthcare because of their large administrative expenses. These expenses include mechanisms to limit care, such as large deductibles, narrow networks, prior authorizations, expenses for obscene executive compensation, and profit. A unified system should not include private insurance companies which add nothing to healthcare except their cost. And second, profit, as in profit distributed to shareholders, should not be allowed. It is morally unacceptable to design a system which generates profits from people's suffering. Thank you.
Thank you very much. We'll be taking the next 4 speakers. So in about the next 4 minutes, if anyone would like to contribute via chat, and of course, always the email address as well. And with that, we'll be moving to James Sarantinos. Please go ahead.
Okay, thank you so much. My name is James Sarantinos, Secretary of Healthcare for All in Los Angeles. I'm the economic pragmatist in the room. There is no room. We can't afford health insurance anymore. Single payer is the way to go. Also, definitely no to Medicaid expansion. Many of the reimbursement rates are an insult to the medical profession. It's time for us to boldly go where every single developed nation has gone before us. Thank you so much. Make this happen.
Thank you. Corinne Frugoni, my apologies. Please go ahead. Corinne, are you able to unmute?
Program.
Yes, please go ahead. Corinne, we're ready for you. Corinne, you've pretty much cut out. I apologize. We're going to need to move on.
Can you hear me now?
Oh, that's better.
Hello?
Try again.
Thank you. Thank you. My name is Corinne Frugoni. I'm a member of Physicians for a National Health Program. I want to thank the commissioners for all the work they've done. I want to address one issue. There may be incremental steps to single payer, but the Office of Healthcare Affordability is definitely not one of them. Single payer will save billions for the state of California. Why spend millions to set up this Office of Healthcare Affordability? Attempting to micromanage the costs of this vast dysfunctional healthcare system using big data will not result in a meaningful improvement to the health and lives of our residents, and errors in data collection, interpretation, and targets could be deleterious to patients and providers. Regulation of profits is limited. Insurance profits are not accounted for as long as the amounts fall within a certain range. The data collected from for-profit entities is dependent upon companies reporting accurate data, which can create potential for fraud. The Office of Healthcare Affordability would attempt to regulate but not eliminate our multi-payer for-profit healthcare system. It attempts to control costs while maintaining the complex multi-payer for-profit system. PNHP California believes eliminating for-profit healthcare is necessary to reduce costs and to remove incentives for withholding care. We foresee the Office of Healthcare Affordability becoming a barrier to this goal of single payer. Thank you.
Thank you. Ruby McDonald, we welcome you to go next.
Because it does catch my attention. It does wake me up. I'm turning this into my own personal therapy session. This is amazing. World's leading expert on the brain.
Ruby McDonald.
So let's move on to number 6, everybody.
Can we please mute everyone else if that's possible? And we're checking to see if Ruby McDonald can unmute. Please go ahead.
My name is Ruby McDonald. I'm from El Cerrito, California. And I think Assemblymember Wood's warning about the status quo opponents of meaningful healthcare reform should be taken very seriously, particularly by publicizing the good work of this commission so that voters will know more about the choices that are available, how reforms can be instituted. Really, I plead for publicizing the work of this commission. Thank you very much.
Thank you. We'll take Arthur Chen next, and I do see that CT Weber has returned in the queue with audio, who will be our last speaker. But first, Arthur Chen, please.
Hello.
Hello, please go ahead.
Hello. Can you hear me?
Yes, we
great.
can.
Okay, thank you very much. And first of all, I appreciate the expertise going into this imperfect but excellent report and going deep into the finances and showing reductions of rate of spending growth and savings from unified financing. And I would further underscore the support and need for unified public financing and single payer as our North Star to achieve the most savings and the most coverage. I agree with what people are saying about the protectors of the status quo. They're going to, from the for-profit health insurance industry, will come out swinging to suppress, demean, and likely misinform the general public about this report and bold reform that disrupts the status quo. Therefore, I urge the committee to have a backbone and conviction and really rely on public will so the plan can go forward and maximize on the opportunities for our general population to weigh in and voice their passion and the pain associated with their life experience due to the ongoing gross inadequacies and tragedies of our current healthcare system. The best practice of leveraging
Thank you very much, sir.
perfect report would be very, very good reports to make it visible and point out of discussion and reference at all conferences related to healthcare
Thank you,
reform
sir.
and all public hearings and all public campaigns. Thank you very much.
Thank you. And we are allowing this one last speaker who actually exhausts the list, CT Weber, who previously had audio problems. CT Weber, please go ahead.
Okay, can you hear me now? Or?
Yes, hello.
Oh, great.
Yes.
Thank you. My name is CT Weber. I'm a Vice President of the California Alliance for Retired Americans. I'm also the Legislative Liaison for Peace and Freedom Party of California, which has basically supported a fully comprehensive, universal, single-payer healthcare system with no copays, no deductibles since the 1980s. For those who are sort of reluctant or hesitant about a single-payer system, I want to emphasize that it is not socialized medicine. They will still have private hospitals, private clinics, private doctors, private drug companies, and so forth. It's not a totally public system. The title of this commission is the Healthy Californians for All. And the problem is that we haven't reached that goal yet. It's not for all. That is still a goal. However, a single payer system will save billions of dollars and provide more benefits and covering everyone, which is important.
Mr. Weber, thank you.
Okay, thank you.
Thank you so much.
You're welcome.
That concludes our public comment, Secretary Galley.
Thank you. So I think it's appropriate to move into our advisory vote.
Yeah, and we do have a couple of slides just explaining the process.
So for commissioners, this is an advisory vote, and the question really at hand is, does the final report conform to the requirements for the report defined in statute, and that it should be transmitted to both the governor and the legislator? An aye vote signifies that you believe it does. No vote signifies that you believe it doesn't. Next slide. So just to go through the statute creating the commission says, the commission shall submit a report to the legislature and the governor that includes options for key design considerations for a unified financing system, including but not limited to a single payer financing system, including all the following: eligibility and enrollment, covered benefits and services, provider participation, purchasing arrangements, provider payments, including consideration of global budgets, cost containment, quality improvement, participant cost sharing, quality monitoring and disparities reduction, information technology systems and financial management systems, data sharing and transparency, governance and administration, including integration of federal funding sources. Next slide. So before we adjourn, let's not get too far ahead. I know there are some commissioners who are, I didn't give people a heads up, we'd be staying a little later, so I apologize to all of you who did stay. I think if we could go to Andy first, and then I know Commissioner Ross did leave. I think I'm going to try to get him virtually to see if we can take his vote as well.
Okay, wonderful. Yeah, so we'll be doing a roll call vote of the voting members on the commission. If you are in favor of this advisory vote, the response is aye. We'll be looking to Andy Schneider first, sir.
An enthusiastic aye.
Thank you very much. Then I'll move to Kara Desert.
Aye.
Thank you. Bill Shao.
Aye.
Thank you. Antonia Hernandez. Antonia Hernandez? Are you muted? You look like you're still muted, Antonia. Is there a way to, there we go. Please go ahead.
Aye.
Thank you very much. Carmen Consti.
No.
Thank you. And moving to commissioners here in the room. Jenny Chin Hansen.
Aye.
Sandra Hernandez.
Aye.
Richard Scheffler.
Aye.
Sarah Phlox.
Aye.
Anthony Wright.
With the hope and expectation of continuing conversation and follow-up and action, aye.
Thank you so much. And do we have Bob Ross on the line?
We do, Bob, if you can hear us. I'm gonna, great.
I can. I apologize for the background noise, but I can't hear you, Mark.
Don't worry, Karen.
Yes, Commissioner Ross, what is your advisory vote on transmitting this report, sir?
Yes, I vote enthusiastically in support. Aye, yes.
Thank you so much. And finally, our chair, Secretary Galley.
Aye as well. Thank you.
Wonderful. So that is 11 of the 12 voting aye of participating voting members today.
Great, thank you, Karen. And now, as the adjournment slide, I just want to take a moment to again thank the commission, the commissioners for your individual sacrifices to help serve on this commission. And then it's appropriate to have my final thanks be to the governor. I want to thank the governor for boldly putting this commission together, to challenging us along the way, the numerous times he asked during COVID, during those press conferences just before or after where we were, and his insistence on pushing me and us forward. I'm grateful for his leadership, and I'm grateful to be able to transmit, based on this advisory vote, this report to him, and to work as part of his team and alongside him to do what I think many of us have called on us to do, which is with urgency and haste, put teams together, do the work that we've talked about in these building blocks, and that as we think about the years to come, the importance of this commission's contribution, and we hope creating a true California for all. So with that, thank you very much. It's been a real pleasure to be alongside all of you.